Well, hello. Welcome to my channel. And joining us tonight is Miss Phyllis, Philosophically Fit. This is Dr. Sherry Tomlin, and thanks for stopping by. And welcome, Phyllis.
Well,
How's
thanks
everything
for
going?
having me. Thank you.
Yes, welcome. And so we were talking last week, and you had some really good information about, things that you're working on as far as fitness and as far as health wise. I was very interested in what you told me. So I've been trying to create a network where we can connect, reconnect, have a platform where we are discussing our health, holistic health, and healing for the Black
hmm
community. So I wanted to have you introduce yourself and tell us a little bit about the things you've been working on and how those things could possibly benefit our community.
Okay. Well, as mentioned, my name is Phyllis, Philosophically Fit. I am currently working on a group fitness instruction certification. While I'm not necessarily interested in group fitness, being a group fitness instructor, it is necessary to go to the next level of another certification, which is cancer therapy exercise, where when individuals have reconstructive surgery that involves skin grafts, they go into immediate stretch therapy. And so that is my ultimate goal. Um, as far as what was that? What else did you want to know, Sherry? I'm sorry.
Right. What are some of the things that you're doing that you feel would benefit people in the Black community as far as fitness and health? Yeah.
Okay, well, we should all exercise. We definitely all need to exercise. But before you can do that, you need to find out what motivates you, because you don't want it to be something that you feel compelled to do. It should be something that you enjoy, something that you look forward to. You can get your best benefits out of it when you have that approach. And the benefits are many.
Right.
You can overcome depression. It builds your self-esteem, improves your self-confidence, uh, your physical health. There are just so many benefits from exercising, and it can be as simple as walking, just taking a walk through your neighborhood. You could join a gym. You could be involved in group activities. It's just so many different things. You just need to get moving. That's important. Get moving.
Right. So when you say exercise, tell us what you have learned about walking. You said one way is walking, one way is the gym. What are some of the results you've gotten from doing those things?
Weight loss, um, improved mental clarity. Um, did I lose you, Sherry?
I'm here. You're still with me.
Oh, okay. Mental clarity, just overall physical strength. Your bones are strengthened. Your mind is strengthened. You have a more positive outlook on
Mhm.
life. You're you're just
More
lighter. You know,
energetic. Uh-huh.
you 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 just feel good. It's a good feeling.
Right. You get more
hmm
energy and yeah.
hmm
So a lot of times what I've seen is people go to the gym and they're not getting results. They can go to the gym like 6 months, a year, and they don't see anything happening. Why is that?
I think it's a mind thing, because I think mostly the first thing people think about when they think about exercise is they think about weight loss. And then when they think about weight loss and they go to the gym and they don't get the results, then they get depressed.
Mhm.
So the approach, in my opinion, to
Or they give
exercise
up, right? Yeah,
should
or they
be
give up.
self care,
Yeah.
bettering yourself.
Yeah.
And everything else that should come will follow. The weight loss will follow, but you need to be in it for better health as opposed to weight loss.
Okay.
um, just the mind, how you approach it. Because if you go to the gym, like you say, you've been going for 6 months every day and you don't see any results, that can be depressing.
Right.
That can
Well,
be very, yeah.
you're exactly right. And maybe some of those people who are not seeing good results should get a personal trainer. I would start out with a personal trainer because I was one of those people. And then I ended up with, meeting a guy, and he wasn't a personal trainer, but he was aspiring to be. And
Mhm.
just the little things that he taught me, if I just get up and do it today, I see good results. He taught me which machines are best and when to use them, how to use them. Do you have any knowledge about those uh, machines at the gym?
Well, see, once again, it's an individual thing when you talk about exercising and fitness and what you like and what works for you.
Okay.
Because the gym and the machines may not be the best fit for everybody. I'll give you an example. I have a friend who wanted me to, she's a group fitness instructor. She wanted me to assist her in her business of what she's doing. She's got a cardio drumming business.
Mhm.
Um, I have a strong disdain for cardio drumming, but she loves it and she thrives at it. She absolutely glows while she's teaching it, but it doesn't do anything
How
for
does
me.
that work? Cardio drumming.
Cardio drumming is, they have music, they have this huge medicine ball and drumsticks, and there's various uh, drum movements that you make, tapping the ball. Um, you rotate in a circle around the ball. It's all centered on this big medicine ball and these drumsticks, and it's sort of kind of like aerobic dancing with cardio sticks.
Was she
I mean,
is she trained to do this,
yes,
certified to do this? Oh,
yes, this is a certified exercise that you will find at most gyms that offer classes, and it's called cardio drumming. It is perfect for someone who has limited mobility because you can do this while seated. So
right.
those who can't walk can still
Any
participate
activity,
in this
yeah,
while seated.
right, any activity could help.
Mhm.
Yeah.
But see,
So,
me myself, I'm more interested in Olympic lifting and strength training. And
yes,
so I love lifting with barbells and dumbbells, free weights, as opposed to machines. The machines are okay and they're good for definition and
right,
things like that, spot
right.
training, but I prefer Olympic lifting. So it all depends on the individual and what they like. I have another friend who likes pickleball, um, and that is, I guess, it's a cross between badminton and tennis. The court, the net is low, like a tennis net,
Okay.
and the instrument is like a cup instead of a tennis racket.
Uh,
Now, she likes that. It's okay. It's nothing I would want to do, but she loves it. So again, it is what works for you
Okay.
to get you motivated and moving, because you got to get motivated. You have to be motivated about what you're doing. You have to enjoy what you're doing in order to get anything out of it.
Okay. Yeah, the friend that I was telling you about, when he started, helped me to start exercising, he said, whatever you do, stay away from the elliptical. That's a waste of time. Okay.
Mm,
The strength training you just told us about was exactly where, he said, do that at least twice a week and do cardio at least 3 times a week. But the spin bike or something like
hmm
that would be
hmm
excellent if you want low impact.
hmm
Some people prefer the treadmill. So I've always stuck by that. When I do my wall presses or my, weightlifting, I was overdoing it. I was doing like 50 of those repetitions. And then I was really sore, and it was like, okay, now I got to take Motrin. And I didn't know I was overdoing it until I saw a YouTube person. I think his name is African Power. Okay. And
Mm-hmm.
he was like, just do 10, start there. And you just start there and gradually get up, not do like 50. Okay, I'm doing 60. And then, oh my God, I can't move the next day. And
Right.
people get, how would you say, they get, they're in pain. So they get turned off by having a weight management routine or exercise routine.
So when you mentioned spinning is probably, in my opinion, one of the best cardioblasts that you could get
Yeah.
ever. Love spinning. Absolutely love spinning.
Yes, now I love it too. So, all right. So, I'm a psychiatric mental health nurse practitioner.
Hmm.
So I've seen the way for myself and for my patients how, exercise does a lot of good, and it can be, life changing for a lot of people. So what we say is just not getting there, get into the gym and do anything. You have to start low, go slow. That's always been my motto.
Hmm.
The psychiatrist that trained me, that was always her motto. And she was like she, a couple of years ago, was the top 10 psychiatrist in Dallas. So
Mm.
she's my mentor, role model. And I would always, Dr. Deepika Bakarva, I would always want to, follow her uh, thoughts and ideas. So
Hmm.
this is Sip and Talk Saturday. I'm sipping on. We got to take a break to let everyone know what we're sipping on. I am sipping on coconut water because I went to an event last night and ended up with a stomach bug at 3 a.m. So I don't know if you can see this, but can you see it? It's coconut water.
Oh, okay. Okay.
So that's what I'm sipping on because I have to rehydrate. What are you sipping on, Phyllis?
I have my gallon of Kangen water, alkaline water, 9.5, and I'm almost there for the day.
You did not tell me that. Well, you're not sipping, you're chugging. But anyway, you know what? I have the Kangen machine, and I
Hmm.
took it to Florida so that my brother could use it because some folks are going through health challenges at his house. So
Hmm.
yeah, that's my machine. I'm going to tell you the story behind that one day, maybe the next time we talk, because
Okay.
I had like stomach aches for like a year and I couldn't figure out what the problem was. And then my friend said to, drink that,
Hmm.
and it went away. I was drinking like ginger ale tea, everything, like 3 days a week, I'd get the stomach ache. And after drinking that, it was gone. And then kind
Hmm.
of realized the root cause of my issue was the wheat. Okay, they modify the wheat so much now that it's not like the wheat back in the 1800s. I
Hmm.
don't even know what these foods that they have. If it's non-GMO or organic, I'm telling everyone, just don't eat it because you're gonna, and
Right.
down the road, maybe not right away, but down the road, you're gonna feel bad one way.
Hmm.
So yeah, where did we leave off? Okay.
We
All right.
took a break.
We
We
took a
we
break.
were wrapping up exercising and the benefits and the different types
Right.
of
So,
exercises that people participate in.
right. And I was telling you about the mental health side of, my business
Hmm.
and getting people to first be motivated. All right. I have to show them because I had one, I had one patient a couple of weeks ago. She was so rude, and she was a therapist, and she was a marathon runner, and she was all these things. But guess what? She was like at the lowest point in life, and she wasn't doing anything. You did
Hmm.
all these things, but right now you're not doing nothing, and you're a wreck. Okay, you're an emotional wreck.
Hmm.
And I said to her, watch this video. It's called The Gift of Walking on YouTube. It's a 7-minute video. There's a doctor that tells everyone the benefits of walking a minimum 15 minutes a day. So
Hmm.
she said to me, a video? You want me to watch a video? I'm a therapist, and then she says, what do you have a degree in? And I'm like, I'm a doctor of nursing practice, and I am a certified psychiatric mental health nurse practitioner. By the time I got through with her, she didn't ask me that again. But I say this to, just that little bit. If you could start there, some people are like, maybe they can only do 5 minutes. Okay. Start
Right.
there. But this video helps you to get motivated. And we have to keep presenting things to our community that could help each other to be motivated, whether it's,
Right.
Zoom meetings like this that we discuss what works for us, what we've been doing, because last time we spoke, we talked about our families leaving a blueprint, right? So for the
Right.
generation coming up, I don't think they got much of a blueprint. We didn't get much. I think we got more than they did, because at least I could say health wise, I don't take any medication. I
Mhm.
know because we are Caribbean Black, even though I don't like that term. I don't like to be divided from my people. We're all Africans, uh, you know, um, and you're foundational Black, and there's continental Black, and all kind of, anyway,
Mhm.
people have their reasons, but we're all sisters. We're all brothers at the end of the day. Okay.
Right.
Nothing separates us. Let's get that out there. All right. So
Okay.
whatever you're calling yourself now, fine, but we know who we are, right?
Right.
So these, people are the older generation. All they told us was to get your education, and my family, at least they told me, if something ails you, go pick a bush, grow something to don't take medication. I was telling you, if we said we had to go to the doctor, it was like, oh, the doctor, it's like, what in the world is
Right.
wrong with you?
Right.
So that was a no-no. We never went to the doctor. So, and that's how I live now. If something ails me, I take something, medicinal herbs or a holistic approach. And so I
Mhm.
was asking you if you take any medication, and I want you to tell our viewers what you told me.
Well, I do not take any medication. However, my parents did. As I mentioned to you before, heart disease runs on my father's side of the family, and diabetes runs heavily on my mother's side of the family. And for me, especially with my mom, she was diagnosed at 60 and she died at 86. She went on dialysis at 80, but to watch her at 80 um, on dialysis with diabetes, having to prick her finger
Mm,
daily for
mm,
just a drop of blood, and how difficult that was just to be able to squeeze out that one drop of blood made me realize that I don't want to be on medication, any type of medication, knowing that it doesn't cure anything. It's just treating symptoms. That's all it is. It's just treating some symptoms. There's no cure in sight for it. I strongly believe that our healing comes from the earth, and for every diagnosis that a doctor gives you and gives you a medication for, there is a holistic herb or oil that will do the same thing. So my
yeah.
thing is get a diagnosis, research it, and find the oil or the herb that cures it. So nope, no medication for me, and
It's working for you.
it's working.
Yeah. Exactly. So a lot of times people don't realize, just because something's running in your family, or, you, mom had diabetes, or grandpa had high blood pressure, and then they feel, there's no hope. But the fact is that we can reverse certain things through diet, the proper
Mhm.
diet, avoiding certain things like, salt and fatty foods, and, high sugar foods, high carb foods, and
Right.
working out. So it is possible to not, or stop that trend that's running in our family, where, everyone has chronic conditions. It
And
doesn't,
water consumption.
a lot more water, the right water.
I mean, people don't drink water. They
Mm.
don't drink water. They drink soda, they drink juice, they drink coffee. But there is
Uh-oh.
not enough water consumption going on either. And that's vital to your health also,
Yeah,
especially with the high blood pressure to flush that salt and everything else that's flowing through to get that flush.
yes, I agree.
Hmm.
So next time, hopefully I'll invite the alkaline water uh, guru. Her name is not Marcia. Marcia is going to be with us uh, in the next part of our show, but we will have Miss Water Guru herself here with us next week.
Awesome.
And maybe you could join us as well.
Okay.
Talk.
Sounds good.
Yeah, she's the one that told me about Donna told me about the Kangen water machine, and that was life changing.
Hmm.
And that machine, could you tell us a little bit before we go about that machine,
I
Phyllis?
can probably
Uh-oh.
not tell you anything about this machine. My daughter is she sells it. She is a
Oh,
part of it's one of her streams of income.
okay.
And she's the expert in this household on the alkaline water. I
Okay.
just drink it. I just drink it.
Oh, well, yeah. We'll learn more about it next week then. All right. Well, I thank you for your time tonight, Phyllis. I'm sure this is going to be a wake-up call for a lot of our people, and hopefully they'll send us our questions. If you do have questions, you can email me at Dr. Sherry Tomlin at outlook.com. DrSheriTomlin at outlook.com. And we'll do Sip and Talk every Saturday, and we'll just keep inviting more and more of our leaders, professionals, elders, because I'm an elder now. And so I'm happy about that. We need to speak to our community. I don't think enough of our elders are speaking to our community. And that's what I'll be talking to Marcia from the reigning queen of Oklahoma about, because a lot of times our people they're just symbols, and they're
Hmm.
just making money, from the people in our community, instead of
Right.
letting them know, okay, what works and what probably won't work, and how to be strong and successful young Black people and older Black people as well.
All right. Well, thank
Any
you for
last,
having me.
any last words before we end our Sip and Talk tonight?
No, just thanks for having me, and I look forward to the next time.
Okay, Phyllis, cheers.